Assalamu alaikum wa rahmatullahi wa barakatuh, everyone. Good evening and welcome to Heart, our new series where we're continuing our Left the Heart at the Masjid themes of bringing in subject matter experts to talk about various topics that might be facing the Muslim community and our Triangle community during this trying time. Previously, during our Left My Heart series, we had several doctors join us to provide an expert opinion on what's been going on with coronavirus, what the virus is, some common precautions, and what the long-term outlook of the virus could be. That was about 3 to 4 months ago, and we thought it'd be a great time to check in and see what's been happening, how the virus has evolved, what's the outlook on a vaccine, if there's any recommendations that we can be reapplying to ourselves, some of the best practices, and as well as hearing some stories of what life is actually like being an ER doctor in North Carolina during this trying time. So in a few minutes, I'll pass it over to one of our respected brothers, Dr. Ayaz Patan, to moderate this discussion with 2 other doctors from the Triangle area. But first, we have a video from Mama Abu Talib regarding our coronavirus strategies at IAR. As many of you know, the masjid is somewhat closed, somewhat open. We're open 5 times a day for the daily prayers, as well as for Jummah. We have a registration system for Jummah that you register on Thursdays at noon, and you can register for all 3 shifts. Currently, we're at 30% capacity, but we're looking to scale up to 50% capacity based on how the trends look in the States. So inshallah, we'll have good news and we'll be increasing capacity shortly. But first, a quick note from Imam Abu Talib on how we're doing and some best practices in terms of maintaining social distancing and preventing ourselves from catching this virus when we're at the masjid. My apologies there. Need to fix a quick thing. Wouldn't be an IAR broadcast without a few technical difficulties.
Rahman Rahim. I want to appreciate on behalf of our leadership, each and every one of you, during this unprecedented and difficult time, your cooperation and support with the unique restrictions that have come with this season, whether the need to wear masks or to social distance or the impact on our children during various prayers and services, has been of paramount importance as we seek to protect one another and especially the most vulnerable in our communities. I want to bring to your attention that even after the initial difficult period, some masajid across the United States are actually experiencing a re-shutdown of their services as COVID outbreaks happen in their congregations and in their localities. And we want to do our part to try to protect every member of our congregation and to make it less likely that this will happen in our situation. For that reason, I want to re-emphasize the importance of your continued support. Remember that Salatul Jummah and the daily prayers are not an individual obligation during this time. However, if you choose to come, it is so important that we each do our part because we don't know what could impact others or even impact the entire masjid if we are not careful with these restrictions. When you come, inshallah, remember, and I know these are difficult, I know they are a sacrifice, but inshallah that sacrifice is accepted in your scales as we think of others and as we protect our masjid, to wear your mask and keep it above the nose and mouth throughout the salah or whatever activity you're here for on campus, and to also keep our distance, whether that's in the marked spaces in the musalla or as we enter and exit the facility, inshallah. Through your cooperation, we will do our part. I know as I come and go in my daily life or getting my needs for my family, alhamdulillah, coming to the masjid remains the most safe and protected space in terms of the protocols that we are taking from anything that I'm interacting with in my life, from our workplaces to our grocery stores. We want to keep doing our part, inshallah, to be as responsible and doing our part, and all protection is from Allah. We ask Allah subhanahu wa ta'ala to protect us and you and your families and our masjid. Allahumma ameen. Wassalamu alaikum.
Hamza, we want to thank everyone for their participation in our social distancing endeavors at IAR, and we appreciate that. We've had almost no problems thus far. Jazakallah khair to our community for that. Now I'm going to pass it over to Dr. Ayaz Patan, who will be moderating a panel with Dr. Akif Rahman and Dr. Yusuf Al-Qadi, all three of whom are ER doctors in North Carolina and at the forefront of the efforts to curb coronavirus within the States. I'm going to pass it over to Dr. Ayaz Patan now.
Right, thank you, Kashif. Thank you for the invitation to return to talk again about coronavirus. A lot has changed. It's interesting. It feels like things change literally every week. So it's almost been an eternity since we've talked about some of these issues. So what I want to do is introduce our esteemed colleagues here. So we have with us today Dr. Akif Rahman. He is a board certified emergency room physician. He's worked at level 1 and 2 trauma centers on both sides of the state and now is settled locally in the central part of the state. Obviously, many in the community know him very well from his time at UNC. And Dr. Yusuf Al-Qadi, who people also know very well from his time here at NC State. He is currently the Chief of Emergency Medicine at Central Carolina Hospital. And I am serving as your moderator today. So what we want to do is go through a few updates that we have here. So an update on how COVID-19 is spread. A lot has honestly changed in the past few months on what the data is showing with that. An update on treatment, which unfortunately is not going to be as good as we would all hope. How the virus is spread, specifically the virus itself, and how to protect ourselves. So, and then hopefully we'll have a little bit of time for question and answer. So feel free to type in your questions in the YouTube chat. So I will kick it over to Dr. Al-Qadi to begin. You are on mute, kind sir.
Good point. Can't be too safe. I guess we're entering the 23rd week of our pandemic, unfortunately, or fortunately, because most of us are still here. Globally, the numbers are as we've expected. I guess there's almost 23 million cases throughout the world and almost 800,000 deaths, but those numbers are still accelerating. And in the US, we have more than a sixth of the number of deaths per day. So almost 6 million cases, 174,000 deaths. And over the last 2 weeks, it's kind of held steady where we're at about 1,000 deaths a day. Worldwide, we're at about 6,000 deaths a day. So I think some of the newer outbreaks have been, I think, Brazil and some of the South American countries where they're having more and more numbers. Just as an idea, as far as how quickly this is accelerating, I like the stat about the positive case count. It took us almost 100 days to get to 1 million cases, a little less than 50 days to get to 2 million cases, 28 days to get to 3 million cases, 15 to 4 million. And then thankfully, it's not continued to double. So it didn't take 7 days to get to 5 million. It may have trended down, but still increasing. It's not gone. Unfortunately, I think a lot of times we have alarm fatigue. And so in February and March of this year, everybody freaked out and took it seriously, and the country and our state went on lockdown, and people are tired of being on lockdown. And so they want to go to school. They want to go, even my dad, who I have 2 small sisters who wanted to go to public school. And he said, hey, can I send them for a week and then do online for 2 weeks? Or should we just do all online? Even he wanted to send kids back to school. But just as an example, UNC and NC State both attempted to reopen, and both of them have clusters. Although states clusters are smaller and less spread than the UNC numbers, but both of them are transitioning to online only classes for the rest of the semester. So their experiment kind of lasted a week, and that was it. They will tell you that the biggest outbreaks have been traced to funerals, fast food restaurants, cruise ships, Navy vessels. I don't think any cruises have been operating in the last few months. But basically, places that you can't socially distance well. In our area, a lot of the clusters have been nursing homes and food processing plants. So things that can't necessarily shut down. You can't close a nursing home. Food is an essential product, so you need food, and I think some of the local chicken plants are situations where they've had clusters where the state came and did on-site testing. This website will give you the best up-to-date information. So all we did was use screenshots, but if you go to https://covid19/ncdhhs.gov/dashboard, it's an amazing tool where you can click on every county and it'll tell you what the case percentages are, or the case counts are for your county, how many people are hospitalized, how many people are in have died. And if we go to the next slide, just the Wake County cases, which is where IR is. So far, we've had 13,000 cases, 188 deaths, and that means about 1.2% of our population has been infected by it. It's not the best, but it's not the worst. If you look at our trends over the last 2 weeks, you'll see that they've kind of balanced out, although unfortunately have kind of rebounded up. If you look at the daily cases, I know just our hospital specifically, we were trying to have, we had no guests for the longest time, so no hospital visitors. And we opened it up where you could have one hospital visitor per day. And then all of a sudden the prevalence went back up and the tests, the percentage of positive test results was more than 10%. It went up to like 13 or 18%. So they shut down visitors again. Similarly, you may see like Georgia was one of the last states to shut down, and then one of the first ones to reopen. And they've had clusters and clusters of cases return. So treatment updates. And the long and the short of this is that there's still nothing proven as an outpatient besides prevention. So if you don't get it, you're okay. A lot of people have asked about like, hey, what about vitamin C or zinc or hydroxychloroquine? At the end of the day, the only treatments that we have that have any kind of proof of being effective are things that are only really useful if you're admitted to the hospital. So if you're not sick enough to be in the hospital, there's nothing that we need to give you, whether it's azithromycin or any other kind of medicine or any antiviral medicine. So the best news for that, as far as your take-home message, is that you don't have to worry about shopping for something. Leave this up to your doctor. The doctors have been doing a good job. I just like to pat everybody else on their back, not necessarily myself, but in the UK, ICU mortality has improved 10 to 20%. And we have different treatments for different phases of the virus. So if you get it early, sometimes there's remdesivir, which you may have seen on the news. The thing with that is it costs a lot, and we're really limiting it for patients that are requiring oxygen. So again, if you're healthy enough and you're safe enough to be at home, you don't need it. There's other questions about, hey, do you need steroids? And steroids aren't really helpful. They actually have some harm if you get it too early in the course. But if you're sick enough that you need to be in the hospital, and the way that I figure that out is, do you need oxygen to maintain oxygen saturation above 90%? So if you're sick enough that you need to be on oxygen, then we have medicine to give you. But if you're not that bad, please stay home and socially isolate and be under home quarantine. Some good news though is that if you have had if you've had the virus and you didn't die, generally speaking, you may have immunity from reinfection for 3 months. Now, the caveat to that is that this study that came out recently, actually, one of my friends told me that, hey man, you're supposed to be immune for 3 months. I got it 2 months ago. I've got a month of free living. I'm going to go hang out. This study only measured people's antibody levels to see if they were detectable. It didn't actually check to see, hey, who got sick a second time and what were the percentages of reinfection. So Theoretically, you should be okay, but I can't tell you for sure. That doesn't mean you're not going to get sicker. And then case reports I've heard anecdotally of people on some of our social media, people getting sicker a second time, and that being related with a more severe illness. I'll tell you from healthcare workers, because we're a special population, you can't not go to work in the hospital. Even with the best layers of PPEs and masks and with adequate coverage, our rates of infection are still higher than the general population. So people may ask me, hey, what mask is the best mask to wear? What should I have a gown on? Do I need to do any other things? Do I need to put on a mask? And what I get out of that is that abstinence is the best policy. I mean, if you can avoid close social contact with other people, if you can stay home, there's nothing that's going to be that as far as safety. Flu, just to give you a heads up, we always worry, at least I'm worried that in the fall, things are going to be worse because everybody's going to be in our hospital with flu and with COVID symptoms. But from South America, who are, again, their seasons are different than ours, more flipped. They're in the middle of their flu season and they found a lot less flu prevalence. And again, that's because everybody now is wearing masks and doing social distance and have limited worldwide travel. So hopefully that'll continue for us and we may have a milder flu season. Yeah. And then vaccines. So everybody wants to know, when's the vaccine going to come out? When can we go back to normal life? And I don't think it'll happen until there's a proven vaccine. There's lots and lots of phase 2 and phase 3 trials. Just a heads up, out of these three groups, the Moderna had a phase 1 trial that showed that the higher the dose you get, the better your antibody levels were. But the higher the dose, you also had more side effects like muscle aches, chills, fatigue, headache. And so they're going to pick a middle dose for their phase 3 trial. Pfizer has multiple candidates. They started a trial last week. One of their trials is being carried out at 120 different sites worldwide. If successful, they are on track to have regulatory review as early as October. And if they get emergency authorization by the FDA, they could have as many as 100 million doses by the end of the year and 1.3 billion by the end of next year. So again, this is very, very accelerated, but maybe there's a light at the end of the tunnel. And then this Novavax one that's going to have phase 3 trials next month. Their phase 1 trial showed that after 2 doses, patients had antibody levels that were 4 times higher than those of recovered patients. So the idea is hopefully there's a lot of potential on the horizon, but nothing that changes your everyday life right now besides washing your hands, keeping socially isolated, and staying at home when you can, unless there's like a birthday party or something you have to go to. But ingest.
Hi guys, Assalamualaikum.
Sorry, go ahead and kick it off.
Assalamualaikum guys, Akif. So I was just going to basically kind of reiterate or reinforce some of the things we've kind of all been hearing about throughout this pandemic. Some of this, Yusuf's already mentioned. First thing is, how is COVID-19 spread? We've kind of already discussed this. There's always been in the news whether this is droplet transmission versus airborne transmission. Still, all the data primarily supports that this is a droplet transmitted disease. Could airborne kind of play a factor? Yeah, it's a possibility. But really, you have to be exposed to a certain minimum level of a viral kind of load threshold to actually become ill from this. And not that droplet is very safe. People think of droplets as large spit particles or a sneeze you can see, but droplets are very, very small, anything more than 5 microns. And you can see that a human hair is 60 to 120 microns. So overall, droplets are very, very tiny, not visible things that are the primary form of transmission. Which means that in most cases, wearing a mask and social distancing are the go-to things to help prevent the spread of COVID-19. Next slide. So this slide again, just reiterating all the things we've heard about throughout the pandemic. It's important that we maintain social distancing, at least 6 feet apart. Regarding masks, the CDC has made additional recommendations that we should be wearing a mask both inside and outside while maintaining social distancing. Along with that, properly wearing a mask, covering your cough and sneeze with either a tissue or your elbow, and washing your hands frequently for at least 20 seconds at a time, and cleaning commonly used surfaces with disinfectants is all important. Just so that everyone's aware, North Carolina does require now that everyone wear a mask both in public and in private kind of indoor, in public, indoor and outdoor settings, even with good social distancing. So just because you're outside does not mean you're safe from spreading or contracting COVID-19. You still need to practice good social distancing and wear a mask. So even if you're on the Greenway Trail or taking a hike, when you're passing by people or coming across people, if you're breaking that 6-foot margin, you're still putting yourself and others at risk. So you should be wearing a mask, outdoors, or at least if you see someone coming towards you, put your mask on. If you're outside in your own yard, mowing the lawn, doing yard work, not coming into contact with people outside your household, then yeah, you don't need to wear a mask, and it's overall pretty safe.
Yeah, just a reminder, if you're sitting in your car by yourself driving somewhere, you don't have to have your mask on. I see it all the time.
But still, it's not going to hurt you. But so if you want to, more power to you.
Yeah.
And then one other thing I want to kind of mention is that just because you wear a mask does not mean you can return to all of your pre-pandemic activities. You just still try to limit the amount of times you leave the house. Only leave the house for essential reasons, getting food or getting some exercise outdoors, sure, but don't just resume your exact same lifestyle and just add a mask to it, because we still have to practice the social distancing component to this and limit our interaction with others. This is again just mentioning the 3 W's we've all heard about: wear your mask, wait 6 feet apart from others, and wash your hands with soap or hand sanitizer for at least 20 seconds at a time. Whether that's the ABCs or reciting Ayatul Kursi, depending on your location, it's something to make sure you wash your hands adequately, make sure you get the spaces between your fingers, wash your hands, your fingertips as well, and just make sure you get everything nice and clean, and do this frequently. Whenever you leave the house, do it. Whenever you touch something, make sure you do it, and try to avoid touching your face. Last thing I just want to kind of reinforce, get in my soapbox, is improper and improper mask wearing. I think the number one thing we see that I see in the masjid even today, I saw several people wearing the mask over their mouth but not their nose, and that's probably the number one thing we see. And most people breathe through their nose, and it really isn't helping you just to cover your mouth and having your nose exposed. The also common beard shield is not very useful for anybody, so please make sure you properly put your mask on over your mouth and nose, and that's a snug fit. A multi-layered cloth mask is fine as well. Just make sure that you do change your mask or wash it regularly. You don't want to wear the same mask for a month straight. And just want to basically reiterate that please wear your mask properly. I know everyone's getting a sense of isolation fatigue and pandemic fatigue, but we need to continue to do our part to stay strong, even though everyone's kind of tired of this whole situation. I guess I'll conclude there and kind of help Yaz and open up for questions.
All right, Jazakallah khair, all very good information. So we're getting some very good questions coming in. So the first of which, and I guess we'll start with Dr. Al-Qadi here, is what are your comments about getting the vaccine when it's available? Obviously, we know that when the vaccine comes out, that it will be new to some degree. How do you feel about it? Would you give it to your children? Would you take it yourself?
Yeah, so I see a shout out to, I guess, Brother Ali Arman asked this about, will they be safe? Would I give it to my kids, et cetera, et cetera? Man, it's tough. Well, nobody knows the answer. Thankfully, all of the side effects that they mentioned on these vaccine trials were, I'll go back and read the list. It seemed like they were all fatigue, chills, headache, muscle pain, which for some people, that might be the side effects that they get from COVID-19. A lot of people have questions about, so like Tamiflu. When I have the flu, what's worse, the side effects from Tamiflu or the actual flu symptoms? I think if you're in a high risk situation that you can't avoid, such as working in an emergency department or working with healthcare, or with patients, but other frontline people. So if you're working at a grocery store or somewhere where you can't avoid the public, I think I would take the vaccine. But would I give it to my kids? I'm not so sure. Just because it sounds like everybody's going to be homeschooling for the next year. Everyone, those things are already kind of shut down. So if you can limit exposures, again, that may be the safest option. If you have to be somewhere out and about, I mean, I'll probably get the shot as soon as they give it to me, man. I'll sign up for one of these trials if you know somebody on the inside, bro.
All right. Thank you for that commentary there. The next question, Dr. Rahman, if you want to take that, it's a question about, as you get your groceries and mail and bring them into the house, should you be wiping that down still? What exactly should you be doing, stuff that you're bringing into the house that you didn't have possession of to begin with?
I mean, overall, I think most people would say that these are very low risk things in terms of, it's the grocery bag that you got from the car. Instead of spending time wiping down the groceries, I would say it's, put your groceries away and then wash your hands afterwards. And then when you check your mail, you might as well just open your mail outside, while you're by your recycling bin, because 80% of it is trash anyway. Put in the recycling bin, take that one piece of mail a day that might be useful, and then come inside and wash your hands.
Hashtag save the postal service.
But I don't think we need to wipe down every piece of every grocery bag and every grocery item. In general, common sense, on the scale of things, wiping down your mail and wiping down your groceries is not highly recommended. But if you want to do it, more power to you. But I don't think it's by any means needed.
Great.
So one of the questions is will it hurt? And I don't think it's going to hurt anything to wipe down the mail. When we look for novel treatments, like whether vitamin C is going to help or zinc is going to help, one of the questions that we ask is what's the harm of doing this? So if there's not any harm from wiping down your mail, by all means, go for it. One of the other things, as an aside, some of in our healthcare, we're talking about how long can I use a mask for? And Dr. Rahman mentioned not using the same mask for a whole month. There are things that we can do to kill the virus. We know a specific amount of heat, UV light, all sorts of other things. But the easiest thing I think that kills the virus is time. And so we had just an internal presentation yesterday that mentioned the virus dies after 4 days. And so this one doctor uses one mask on Monday, and then he sits it in his garage and he doesn't pick it up again until Friday. And so theoretically, if you brought in your mail and you just read it 4 days later, you should be fine. Anyway.
All right, Jazakallah khair. We are running short on time. Do you have any kind of last words for us, Dr. Rahman? Maybe something to advise our community, maybe a 30-second conclusion for us all?
Can't put me on the spot right there. I would say the main thing is to reiterate, wash your hands frequently, wear your mask when you go out and are in contact or have a chance of being in contact with people, within 6 feet, maintain a distance and, practice good social distancing, stay strong. It's very easy to kind of become fatigued and depressed in the situation, but you have to kind of maintain the optimism. Hopefully we'll have, maybe even 2 or 3, viable vaccines and, around the new year, hopefully. And, things are looking up, hopefully, and kind of stay strong and yeah.
Great. Appreciate it. All right. Well, thank you both for taking your time out from your busy days. I know you guys are both on the front lines and daily seeing COVID patients, from the walking wounded to the ones that need ICU services. So we appreciate everything that you do. Thanks again for inviting us, Kashif.
Thank you so much, Dr. Akif Rahman, Dr. Ayaz Patan, and Dr. Yusuf Al-Qadi for joining us. We learned a lot, and this will be distributed in our email list this week. To put Dr. Patan on the spot, would you mind closing us out with a final dua, please?
Just put me on the spot. أعوذ بالله من الشيطان الرجيم. بسم الله الرحمن الرحيم. ربنا أعطينا في الدنيا حسنة وفي الآخرة حسنة وقنا عذاب النار. Ya Allah, please protect us all from the coronavirus. Ya Allah, please protect our children. Ya Allah, please bring shifa to those that are sick. Ya Allah, please bring a cure to this disease. Jazakallah khair. Assalamu alaikum.
Alhamdulillah.
We're done on
Rest the
YouTube.
people that